Hello everyone, myself Dr. Akanksha Tripathi and I'm working as consultant in the Department of Obs and Gynae at GBH American Hospital, Udaipur. While the world is coping up with COVID-19 pandemic, it is very important that we discuss something about our pregnant patients. There is a lot of anxiety, there is a lot of fear in them that they may catch COVID-19 during their pregnancy and it may affect their future babies. So it is very important to share certain facts how COVID-19 can affect their pregnancies in case they catch it, and whether the vaccination is safe or not, whether they can take vaccine during breastfeeding or not. So I'm here to share some of the facts and hope it helps them out. Studies have shown that pregnant women are not more likely to get COVID-19 infection. So they should not have this fear that I'm more prone to catch COVID-19 as compared to general population. No, you are not. Roughly two-thirds of pregnant patients, in case they get COVID-19, they will have very mild symptoms, cold and flu-like illness symptoms. So they need not worry about it a lot. A very small number of patients can get some serious symptoms and they can become really unwell, and especially during the third trimester. So last 3 months they should be extra careful or extra cautious so that not to catch COVID-19 during their third trimester. Pregnant women have been included in the list of people at moderate risk as a precaution. When we talk about common doubts, one common doubt is, should I plan my pregnancy during COVID-19 pandemic? The answer is, it is your personal choice. As a gynecologist, as a clinician, I would suggest there is no way, there is no reason or no excuse that you should not plan your pregnancy. But yes, in case you're very young, you have been like recently married, you may avoid it for 6 months or so, and wait for things to change and maybe then plan a pregnancy. Current evidence suggests that it is unlikely to cause any problems to your baby. There are no reports so far that it affects the development of the baby. So let's get this out very clear, that even if you get pregnant during COVID-19 or you catch COVID-19 during your pregnancy period, it is not going to produce any congenital anomalies in your baby. And there are patients who have even asked that in case I get COVID-19, should I go for a termination? No. Again, the answer is no. It is not at all an indication for medical termination of pregnancy. Now, let us know who all are at more risk. I wouldn't say that there is no risk at all. Yes, some of the pregnant patients, especially those who have heart disease or those who are suffering from some sort of a chronic illness like diabetes or hypertension, or they are obese, they're elderly, or they are on some sort of a steroid therapy. Yes, they are at in that moderate risk, I would say, for COVID-19 infection. One another aspect of your health which is very important to discuss is your mental health. COVID-19 somehow has increased the cases of anxiety neurosis. It is giving you some sort of depression. So it is very important that you regularly do some sort of meditation, read good books, keep yourself surrounded by positive people, stay away from a lot of social media, a lot of news which are being floated over various social media channels. I feel pregnant women should stay away from them. You should read good books, talk to good people, stay close to your family and your friends, stay in touch with your treating doctor. Think about positive things. This phase will also pass one day, very soon. With regard to vertical transmission, as I said, I would again repeat, there is very, very less chance of any transmission from mother to baby. Some few reports, some few cases have been reported. Otherwise, more or less, there is no transmission from mother to the baby. In case your baby get affected, the worst scenario is that you catch COVID-19, you deliver, and then your baby gets affected. First of all, even the neonates have very mild symptoms during their early neonatal life. They present with probably fever or diarrhea, And in case, I always choose a good center, a good tertiary center to plan your delivery during this period. It is very important that a good neonatologist or a pediatrician attends your delivery or attends your baby. That is one thing which is very important. As far as advice goes, yes, there is no doubt that you have to follow all the norms and precautions. The rule of social distancing, hand hygiene, wearing a mask applies on all the pregnant patients as well. Rather, I would say if you're using a mask or if you're in a joint family, if there is less separation from other family members, you can even use a mask inside your home. Even if there is nobody who's infected inside your house, you should still try to maintain some distance from people who are working outside or who are daily going outside the house for their job or etc. Keep yourself mobile, well hydrated. Yes, good nutrition, good hydration, and a good amount of sleep or rest are very important. These are the key factors which decide your good health during this pandemic. Regular mild to moderate exercise, whatever you have been doing, like walk or yoga or some easy home workouts you can do along with this balanced diet. Folic acid, vitamin D supplements, and rest of the supplements like iron, calcium, which have been prescribed by your gynecologist, continue taking them. Rather, you should keep on asking regarding the dosage and all, and you should not miss out on your regular supplementation. Regarding appointments or regarding antenatal visits, again, a lot of patients ask us whether we should avoid coming to the hospital. My answer to this would be no. Pregnant patients, as per the guidelines, they should not miss their antenatal visits and their antenatal scans. Even if we sort of tailor down their visits, it should be made at least 12, 20, 28 and 36 weeks. Roughly, I would say 3rd month, 5th month, 7th month and the beginning of their 9th month. These visits must be done. For mild complaints, something which you need to ask, yes, you can consult your doctor over phone, over a phone call or a message. But for proper antenatal examination, you must pay a regular OPD visit. And we ensure that all the hospitals are keeping, are following this segregation policy and social distancing policy. And we try to provide a very safe environment to all our patients. Whenever there is any doubt, there is any new symptom which you feel is cropping up, you must discuss it with your doctor. And whenever you're visiting a hospital or you're going for your regular antenatal visit, you must share all the relevant history. Do not miss out on your recent travel history, or if you stay in an area which is a hotspot area, you must share it with your doctor. There should be no hesitation. Now, COVID-19, there is a lot of awareness about it. Everybody has become so familiar with it. One should not attach any sort of a stigma to it. All of us have been, have seen this pandemic or have seen this illness so closely in our lives. Most of us have even experienced in some of our family members. So we should not give it even a second thought sharing about it. So if there is anybody who's positive in your family, inform your doctor over phone. Try to have that 14 days of quarantine and then plan your visit. A one antenatal ultrasound or a one follow-up scan is very important after this 14 days of quarantine. And if you have any sort of flu-like symptoms or something, you can defer your visit by 7 days and then come. As far as your antenatal care and your care during delivery and everything is concerned, we are there to take care of it. As far as breastfeeding and vaccination goes, even if you're COVID-19 affected individual, you will be allowed to breastfeed your baby, although following certain precautions that you have to follow. Strict hand hygiene, you will have to wear a mask, you will have to wash your hands before you get in contact with your baby. Until and unless someone is seriously unwell, we allow this breastfeeding. Otherwise, we go for the options like breast milk donation, or you can just extract breast milk and you express breast milk and give it to your baby later on. Regarding vaccination, see, again, a lot of studies have come up. As far as certain companies like Moderna, Pfizer, J&J are concerned, vaccines are completely safe. They have done their studies on animals and they have done clinical trials over pregnant women also. But as far as Indian vaccines are concerned, that is Covaxin and Covishield, FOXI, the Organization of Obstetrician and Gynecologists of India, they do recommend, but Government of India still have not given permission for it. So we are waiting for that permission, and that is why we are not prescribing it in all the pregnant women. So those who are at high risk, yes, we do offer them to make a choice. But those who are lactating or breastfeeding their small babies, they can definitely go for vaccine. They should not even give it a second thought and just go for it. I feel I have tried my level best to summarize what pregnant patients should do during this COVID-19 pandemic, and you must stay safe, do not worry a lot, and as I said, take good rest, proper hydration, a well-balanced diet, and a regular antenatal visit should help you out to overcome this COVID-19 pandemic. Thank you.